Good afternoon, everyone. My name is Kenan Widener. I'm a registered nurse at Lancaster General Hospital and a student at Pennsylvania College of Health Sciences. Today I want to talk about education and nursing. Along with these objectives, I would like to pose the question, does having a higher education as a nurse lead to higher quality of patient outcomes? Hopefully you'll be able to answer that at the end of this presentation. For starters, the Institute of Medicine back in 2010 recommended that by 2020, 80% of nurses have their BSN. Currently, nursing is unique in that there's 3 ways to enter practice. You have your diploma, your associate's degree, and your bachelor's degree program, all allowing you to sit for your NCLEX at completion. As of 2014, an estimated 55 to 60% of RNs do have their BSN, so we're going in the right direction. And evidence has found that units staffed with a higher percentage of BSN nurses do decrease the mortality rate. The influence this will have on nursing is that eventually the vision is that the BSN will be the minimum level of education to become a registered nurse. This will allow for better patient outcomes, as research has found, quicker transitions to roles as educator, researcher, and advanced practice. All of those roles are becoming more and more important as our healthcare system changes. Many people often ask, how can a nurse who is a professional in the healthcare field only have a diploma when the members of the interdisciplinary team, speech, PTOT, nutrition, pharmacy, they all have at minimum a bachelor's degree, if not a master's or a doctorate. The thought is that we have a more complex healthcare system. Patients are living longer and sicker. They have multiple comorbidities. Having a higher education level allows you to better handle those patients. You're more familiar with technology. You're more up to date with medications. You're more up to date with what is the best evidence-based practice for any given situation that you're in. Multiple studies have concluded that there's a 10% increase in BSN nurses, there is a 5% decrease in patient mortality. The impact on healthcare, there's a projected nursing shortage coming our way as the baby boomers retire. The percentage of baby boomers with their BSN is lower though, so as they retire, the percentage of BSN nurses overall should go up. The aging population, along with an increased amount of Americans now having health insurance, leads to a higher patient population. It's harder for students to replace the outgoing nurses who are retiring when they have to go to school for 3 to 5 years to have their BSN. The other quality indicators that were studied also showed that having units staffed with higher percentage of BSN nurses, there are lower rates of CHF, pressure ulcers, blood clots, failure to rescue, and a decreased length of stay. However, questions that I pose are, if we're requiring higher education of the BSN, are we going to have lower staff because we're pushing nurses who don't have their BSN out? And with tight healthcare costs, can we create a financial incentive for BSN nurses? Because currently there's no incentive to have your BSN in most locations. The impact on society. Society is going to benefit for decreased mortality rates within the hospital, better outcomes within the hospital. Society could lose some jobs if nurses are pushed out. There would be a shortage. We need more nursing schools, but that should also create jobs. Shorter inpatient stays means a shift to the outpatient setting, meaning less chance of infection in the hospital. People get to stay at home longer. Also, like I said, there's no incentive for people to have their BSN, so maybe nursing will look less attractive as a career choice. One study did conclude that the best combination is having higher educated nurses with better staffing ratios. That's the way to achieve the best outcomes. However, hard to do if you're pushing nurses out and requiring more education just to enter practice. Here is a visual that shows on the left, these are BSN staff hospital, a higher percentage of BSN staff hospital, and you see the negative numbers, that's a decrease in those indicators. CHF, pressure ulcers, blood clots, length of stay. So that's obviously a good thing. It correlates that having your BSN decreases those numbers that are not good. They're quality indicators, so that's just more evidence to suggest that. So in summary, again, the Institute of Medicine recommends 80% of RNs with their BSN by 2020. That's obviously something that hospitals take very seriously, especially magnet hospitals. If they want to obtain or sustain their magnet certification, they're going to want to do what the Institute of Medicine recommends. So they've really locked on Lancaster General, for example, by the end of December 2019. In order to work in the inpatient setting, you do need to have your BSN, otherwise you're reallocated elsewhere within our system. I believe that advanced practice nursing roles may follow this lead. Your midwives, your nurse practitioners, your anesthetists, those master degrees programs now will eventually probably be doctorate programs just to enter those fields. But again, the evidence does show that in mortality and multiple quality indicators that having BSN educated nurses does lead to higher quality of care. So it's important for us to have a plan moving forward to address the nursing shortage, the nurses that do not have their BSN, so that there's a plan in place to benefit everyone. Thank you for listening to this presentation. If you have any questions or comments, you can post in the discussion board.